As the pandemic continues, small doctor clinics are struggling to keep their doors open. Some say patients are too scared to come in. News 19's Eleanor Tabone tells us more.
As an independent physician, you start worrying about the finances.
According to a new study by the American Medical Association, 1 in 5 doctors saw revenue drop by more than 50% during the pandemic.
How are we going to cope with this?
To keep their doors open, they were forced to adapt.
Got a geriatrics practice.
Dr. Mays DeBose focuses on geriatric care.
They don't all have iPhones, and the ones that do don't all use it well.
His clients are at greatest risk.
I knew I had patients that didn't have internet at home.
To protect them, he transitioned to telehealth.
You had to devise a way to, let them safely come in the office in a room by themselves at a computer that we had set up so that we could still see them from a distance, but safely.
A second-generation doctor.
Learning telemedicine and then teaching telemedicine was it was a steep climb.
He says telemed isn't a viable option.
From a safety standpoint, I felt like it was a very clear decision, but then from a financial standpoint, it was a very scary decision.
Small healthcare practices have been impacted by COVID-19. Some physicians say they've seen a 32% drop in revenue simply because people are too scared to come into the clinic.
There's no question that the amount of revenue coming into our practice dropped off precipitously.
Family doctor John Robb says he had to apply for funding to keep his business afloat.
We're a small business.
Losing his business became a scary reality.
Small practices that have had to close the doors at least for a season.
In Columbia, Eleanor Tabone, News 19 WLTX.
Tonight, some small practices say they're getting closer to some normalcy. Patients still aren't allowed to use the waiting room. They must enter through the back door one at a time, and masks are required.